Welcome back. I hope you guys are learning a lot about your walking pattern and becoming more aware about it. So first we said, okay, do you have a heel strike? Then do you shift your weight appropriately? Is it your trunk leaning, or are you shifting your weight through your trunk and over your hips? Now we're going to look at when you put weight on your leg and you start to add weight onto your stance leg, do you feel your inner thigh muscle kick in? Now this is something very, very subtle, but it can provide a lot of relief to people. So I'm gonna go ahead and get you guys settled. We're gonna take a look at legs and how they move. Okay, so our inner thigh muscles right here by our groin, both of them are very important. For the most part, people can feel their right inner thigh muscle because they're used to standing with their hip cocked to one side and standing on their right leg. And so that left inner thigh or right inner thigh muscle is used to being worked. Now the left inner thigh muscle is usually a problem and usually contributes to a lot of issues in the pelvis and hip area, low back, because we often can't feel that muscle. So when we walk and we put weight through our legs, we talked about how we want to shift our body weight over. Well, as that happens, we want to feel our inner thigh muscle kick in so that we can stabilize our hips side to side when we bring our other leg through. So when I step here, I want to feel my inner thigh muscle as my left leg comes through. That helps to stabilize me. And then the same thing that happens when I step forward with my left foot, my left inner thigh muscle kicks in to stabilize me side to side as my right leg swings through. Now this is really critical in the walking pattern, but most of us don't even notice it or feel it. So when I'm walking here and I walk, I feel my heel strike, so my hamstrings kick in, now my inner thigh, now my other heel, and then my inner thigh. So right hamstring, right inner thigh, and so forth. So this is important that we feel this because it helps provide us side to side stability. It helps us with our weight shifting so that we can maintain our balance. It helps us so that we use our thigh muscles more than our back muscles. And so this is very important. As you walk and you assess yourself, see, do you feel your hamstrings? Do you feel your inner thigh? It might be a blip of feeling. And even sometimes thinking about the inner thigh, you start to feel it. So right now, right inner thigh, left inner thigh, right inner thigh, and so forth. You can feel it, and it can be very powerful in giving you stability and helping you decrease some compensations around your body. This is all very important to assess and to look at for your walking pattern. Again, this is something that is very helpful to assess on ourselves, but it's also really important to get someone else who's in the healthcare field to work with you. Someone like me who does this for a living, who helps people with this. I'm sure there are other people in your community too, if you want to reach out to them. But just find someone who can give you the outside input and can really watch. If you change one thing based on my suggestion, do you start to compensate in other places? If so, that your body may not be right for that one change because you have to address something else so you don't compensate. There's a lot that goes into this, and so I'm providing you education that you can assess yourself to help you get better with your healthcare provider. Otherwise, have a great week. Feel free to reach out to me as always, Amy@paverinstitute.com. Love to hear from you. Thanks guys. Bye.